There is a pandemic of silent killers destroying the lives and livelihoods of people worldwide. 15 million people die from non-communicable diseases, or NCDs, prematurely between the ages of 30 and 69 every year, and 85% of these deaths occur in low and middle-income countries. Each year, NCDs that are not passed from person to person and slowly progress over time are responsible for more than 2/3 of all deaths worldwide. In 2016, almost 1 million people died in Brazil from NCDs. Similarly, over 70% of all deaths in Malaysia in Asia and in the United Arab Emirates in the Middle East were due to NCDs. Several modifiable risk factors are responsible for the key NCDs, such as heart disease, diabetes, chronic respiratory illness, and cancer. Of these risk factors, a poor diet, obesity, and raised blood pressure top the list across all emerging nations. Dying prematurely from NCDs has a tragic impact on communities, from the profound emotional and financial burden on families to the loss of productivity for the nation. This tragedy is largely preventable. In September 2019, a think tank of experts from key emerging nations gathered to explore the impact of NCDs, discuss challenges to combat them, and offer some pragmatic solutions. This expert forum on NCDs in emerging nations included frontline clinicians in public health and private practice, civil society, from academia, public policy, patient advocacy, and the private sector. This expert forum identified that limited universal health coverage, gaps in implementing regulations, the availability and distribution of the health workforce, and gaps in data were barriers to reducing the burden of NCDs. It found there was a need for intersectoral partnerships to address some of the needs. The dialogue and deliberations on the way forward are detailed in this paper, Systemic Solutions for Addressing Non-communicable Diseases in Low and Middle-Income Countries. It highlights that a multi-stakeholder collaborative approach with locally tailored solutions is key to reducing the burden of NCDs in low and middle-income countries. The cost of addressing NCDs is much less than the toll taken by them. The investment needed to improve outcomes for NCDs can be out of reach for many low and middle-income countries, especially for the low-income countries. For some, their healthcare budgets get augmented by development assistance for health, but only 1 to 2% of this external funding gets allocated to combating NCDs. The result has been the burden of NCDs continuing unabated. So how can the private sector help control NCDs? A high-level meeting held during the United Nations General Assembly in 2019 acknowledged the significance and complexity of NCDs and the challenge for governments to work alone in managing them. Along with a call to further strengthen efforts to address NCDs, the high-level meeting fostered public and private sector collaborations. The expert forum also saw the potential for the private sector to be involved in health system strengthening at many touchpoints along the patient journey. Patients are becoming empowered and seek more information now when it comes to treatment decisions. NCDs are linked to risk factors. Awareness of these risk factors in the population remains limited, with most people being diagnosed following acute events from the disease. So while the education of health workers remains critical to bridge gaps in knowledge and practice, improving health literacy among at-risk populations and patients who have NCDs can enable them to be more involved in their prevention and care. So as a collective, it's important that stakeholders from both public and private sectors recognize the critical role they play in helping to curb the rising tide of NCDs across the globe and at the local level.